Hello and welcome to my channel. Today we are going to discuss about ear infections. Ear infections are common in children and they can be quite painful. In fact, ear infections are one of the most common reasons why parents bring their children to see me. To understand the ear infections, it is essential to know a little bit about ear's anatomy. Ear has three parts: the outer ear, middle ear, and the inner ear. An ear infection occurs when bacteria or viruses get into the middle ear and cause inflammation. One of the most common symptoms of ear infection is the buildup of fluid in the middle ear cavity, which can cause pain, discomfort, and a feeling of fullness in the ear. Other symptoms of an ear infection can include fever, irritability, poor appetite, and difficulty sleeping. In some cases, there can also be hearing loss. If your child has an ear infection, treatment will depend on the severity of infection. In many cases, antibiotics are prescribed to clear up the infection. Pain relievers such as acetaminophen or ibuprofen can also be used to relieve the pain and discomfort. In some cases, the ear infection can cause temporary hearing loss. So, it's essential to have your child's hearing tested after the infection has cleared up. There are also steps you can take to help prevent ear infections in your children. For example, make sure the child receives all the recommended vaccinations which can help prevent the infections such as the flu and pneumococcal disease. Encourage good hygiene habits such as washing your child's hands regularly and avoiding exposure to cigarette smoke, which can increase the risk of ear infections. In conclusion, ear infections are common in children, but with proper treatment and preventive measures, most children will recover quickly and without complications. If your child is showing symptoms of ear infection, make sure to consult your pediatrician for proper diagnosis and treatment. Hope you like the video. Please like and subscribe the channel. Thank you.